Did you know that hundreds of thousands of people in the United States are diagnosed with pancreatitis every year? This condition is more common than many realize, affecting people of all ages and backgrounds. The statistics are staggering, and the impact on individuals and families can be profound. It's a serious condition, and the number of cases is on the rise. This increase can be attributed to various factors, including lifestyle choices, genetic predispositions, and other underlying health conditions. The healthcare system is continually adapting to manage the growing number of patients, but awareness and education are crucial. This is especially concerning for older adults, who are more vulnerable to developing this disease. As we age, our bodies become more susceptible to inflammation and other complications. Therefore, it's essential for seniors to be particularly vigilant about their pancreatic health and seek medical advice if they experience any symptoms. Pancreatitis is a condition that affects the pancreas, an important organ located in your abdomen. The pancreas has a dual role. It aids in digestion by producing enzymes and helps regulate blood sugar levels by releasing insulin. When the pancreas becomes inflamed, these functions can be severely disrupted, leading to significant health issues. The pancreas plays a vital role in digestion and regulating blood sugar. It produces enzymes that help break down food in the intestines and hormones like insulin that control blood sugar levels. Maintaining a healthy pancreas is crucial for overall well-being, as it directly impacts how our bodies process nutrients and manage energy. When it becomes inflamed, it can cause a range of uncomfortable and potentially dangerous symptoms. These can include severe abdominal pain, nausea, vomiting, fever, and a rapid pulse. In some cases, pancreatitis can lead to more serious complications like infections, cysts, or even chronic pancreatitis, which can have long-term effects on health. The good news is that with early detection and proper management, you can live a full and active life with pancreatitis. Treatment often involves a combination of medication, lifestyle changes, and sometimes surgery. By following your healthcare provider's recommendations and making healthy choices, you can manage the condition effectively. That's why it's so important to understand what pancreatitis is, how to recognize the signs, and what steps you can take to protect your pancreatic health. Educating yourself and your loved ones about this condition can make a significant difference. Early intervention and proactive care are key to preventing complications and maintaining a good quality of life. Let's take a closer look at the pancreas and understand why it's so important for our health. The pancreas is a small but mighty organ tucked away behind your stomach. It's responsible for producing enzymes that help you digest food and hormones that regulate blood sugar levels. Now imagine your pancreas like a garden hose. In pancreatitis, this hose gets kinked, causing the digestive enzymes to build up inside the pancreas instead of flowing out to the intestines. These enzymes, meant to break down food, start irritating and inflaming the pancreas itself. This inflammation is what we call pancreatitis. It can range from mild to severe and can be either acute, sudden and short-term, or chronic, long-lasting. Understanding the different types of pancreatitis is crucial for proper diagnosis and treatment. Pancreatitis can manifest in two main forms, acute and chronic. Understanding the differences between these two types is essential for proper diagnosis and treatment. Both forms affect the pancreas, but they do so in distinct ways, leading to different symptoms, complications, and management strategies. Picture acute pancreatitis as a sudden storm. It comes on quickly, can be quite intense, but often subsides with time and treatment. This sudden onset can be alarming, causing severe abdominal pain, nausea, vomiting, and fever. The intensity of the symptoms often leads to an emergency room visit, where immediate medical intervention is crucial. Chronic pancreatitis, on the other hand, is more like a persistent drizzle that gradually wears down the pancreas over time. Unlike the sudden storm of acute pancreatitis, chronic pancreatitis develops slowly, often over many years. This persistent inflammation can lead to ongoing pain, digestive issues, and eventually, diabetes due to the pancreas's impaired ability to produce insulin. Acute pancreatitis is characterized by sudden and severe inflammation of the pancreas. The pain is often described as a sharp stabbing sensation in the upper abdomen that can radiate to the back. This condition requires immediate medical attention to manage the inflammation and prevent complications such as infection or organ failure. It's often triggered by gallstones or heavy alcohol consumption, but other factors can contribute as well. These include certain medications, high triglyceride levels, and genetic predispositions. Identifying the underlying cause is crucial for effective treatment and prevention of future episodes. With prompt medical attention, most people with acute pancreatitis recover fully. Treatment typically involves hospitalization, where patients receive intravenous fluids, pain management, and sometimes antibiotics. Once the acute episode is resolved, patients are advised to avoid triggers and make lifestyle changes to prevent recurrence. Chronic pancreatitis develops gradually over time, often as a result of repeated bouts of acute pancreatitis or long-term alcohol abuse. The ongoing inflammation leads to progressive damage, causing the pancreas to lose its ability to function properly. This can result in chronic pain, malnutrition, and diabetes. The persistent inflammation causes irreversible damage to the pancreas, leading to scarring and impaired function. This scarring, known as fibrosis, can obstruct the pancreatic ducts, further complicating digestion and leading to severe nutritional deficiencies. Understanding the distinction between these two forms is crucial for determining the appropriate course of treatment and managing the condition effectively. While acute pancreatitis requires immediate intervention to address the sudden inflammation, chronic pancreatitis necessitates a long-term management plan to handle ongoing symptoms and prevent further damage. Both conditions highlight the importance of early detection, lifestyle modifications, and regular medical follow-ups to ensure the best possible outcomes for patients. Section 4. Red flags. Recognizing the symptoms of pancreatitis. Understanding the signs and symptoms of pancreatitis is essential for early detection and treatment. This can help prevent severe complications and improve outcomes. Recognizing the symptoms of pancreatitis is crucial for seeking timely medical attention and preventing complications. Pancreatitis can present itself in various ways, and being aware of these signs can make a significant difference in managing the condition effectively. While both acute and chronic pancreatitis share some common symptoms, there are also some key differences to be aware of. Acute pancreatitis typically comes on suddenly and can be very severe, whereas chronic pancreatitis develops more gradually and can persist over a long period. The most common symptom of both types is pain in the upper abdomen, often described as a burning or gnawing sensation. This pain can be intense and may last for several hours or even days. This pain may radiate to the back and can be aggravated by eating, especially fatty foods. It's important to note that the pain can vary in intensity and may be accompanied by other symptoms. In acute pancreatitis, the pain is often sudden and severe, accompanied by nausea, vomiting, fever, and a rapid heartbeat. These symptoms can be alarming and may require immediate medical attention. The abdomen may also be tender to the touch. This tenderness can be a key indicator of inflammation in the pancreas and should not be ignored. Chronic pancreatitis, on the other hand, tends to cause persistent pain that comes and goes, along with other digestive issues like diarrhea, greasy stools, and unexplained weight loss. These symptoms can significantly impact a person's quality of life and may require ongoing medical management. If you experience any of these symptoms, it's essential to consult your doctor promptly for a proper diagnosis. Early intervention can help manage the condition more effectively and prevent further complications. Don't hesitate to seek medical advice if you notice any concerning signs. Section 5. Unraveling the causes. What leads to pancreatitis? Understanding the causes of pancreatitis is essential for prevention and management. While several factors can contribute to this condition, gallstones and heavy alcohol use are the most common culprits. Gallstones, small hardened deposits that form in the gallbladder, can obstruct the bile duct, leading to inflammation of the pancreas. This is because the bile duct and pancreatic duct share a common pathway, and a blockage in one can affect the other. Excessive alcohol consumption, especially over a long period, is another major risk factor for pancreatitis. Alcohol is toxic to the pancreas and can trigger inflammation, leading to both acute and chronic pancreatitis. Other less common causes include high levels of triglycerides in the blood, certain medications, infections, genetic disorders, and trauma to the abdomen. Section 6. Pancreatitis in action. How it affects your body. Pancreatitis, whether acute or chronic, disrupts the normal functioning of your pancreas, affecting your digestion and blood sugar control. Let's delve into how this inflammation impacts your body. The digestive enzymes produced by your pancreas are essential for breaking down food into nutrients your body can absorb. When the pancreas is inflamed, these enzymes can't reach the intestines to do their job, leading to poor digestion and nutrient deficiencies. Furthermore, the pancreas is responsible for producing insulin, a hormone that regulates blood sugar levels. Inflammation can damage the cells that produce insulin, increasing the risk of developing diabetes, especially in people with chronic pancreatitis. Over time, chronic pancreatitis can lead to complications like malnutrition, weight loss, diabetes, and an increased risk of pancreatic cancer.